on health. Listen to this.
That through U.S. government, through the President Joe Biden, has recently given African Union about 5 million doses of Pfizer, 10 million doses of Pfizer, and 5 million doses of Johnson & Johnson. I'm also happy to say that Ghana will be receiving about 1.2 plus million of Pfizer soon, very, very soon, so that we can have our second deployment phase with Pfizer and Pfizer. We are working around the clock to get another few doses of AstraZeneca to be able to complete the first deployment phase that we did for the about 464,000 people to be vaccinated. And hopefully we'll get more from all the other sources that we have put in place, both direct from government to government, multilaterals from African Vaccine Alliance Trusts and from African Medicine Supply Platform, and also from COVAX. And Ghana government is also going around trying to also use government to government to bring in vaccines that we have given emergency use authorization in Ghana. So far that's about the vaccines. Okay. And when the time comes and the vaccines are in, we will let everybody knows. And what we want to do is that people should be ready and they should make themselves available to go for the vaccination when it's announced and where we are going to give it.
So that's some good news.
Yeah, that was Dr. Anthony Nsiansari talking on vaccines. Now, let's see if we can expand this conversation, and we will start from the point of vaccines, I think. Our guests joining us today via Zoom and via phone. Let's say a quick good morning to them. First of all, Dr. Justice Yankson is the General Secretary of the Ghana Medical Association. Good morning to you, Dr. Yankson. Right, but I think we're connecting to Dr. Yankson. But we do have Dr. Yaw Bediako. He's a research fellow at the West African Center for Cell Biology of Infectious Pathogens, WACBIP, and that's at the University of Ghana. Dr. Bediako, it's good to speak to you again. Good morning.
Good morning, Kojo.
All right then. So, I mean, let's get to brass tacks. We have variant upon variant in the system now, confirmed, established, they are here. But one would be forgiven for thinking that we have actually relaxed the protocols. Is that the way to go? I mean, what seems to be the game plan here from your understanding of how it's being managed? What's the strategy?
Oh, I think Dr. Nsiansari will probably be the best person to describe the strategy. He is, I believe, in charge in many ways, as well as the Ghana Health Service. So, the Director General,
right.
Director of Public Health. I can only comment from my view as sort of an observer.
Please do.
And you are right. It has felt as though there has been a relaxing of restrictions. I think up until the emergence of the Delta variant. So I think we have to ask ourselves what next. I mean, as our case numbers rise, and as we get reports of more and more people requiring hospitalization, there has to be a response. We cannot continue as we have been. So I think that the question that now faces the authorities is, what should the response be? How do we try to minimize the spread? It's a little bit difficult to put the horse back in the stable, as it were. But I think there has to be a general tightening of our posture towards the virus. There has to be a general recognition that this pandemic is far from over, and in fact, it may be entering its most dangerous phase yet. And so there has to be a sobering, I think, of our attitude towards this pandemic, not just on the part of authorities, but on the part of all of us as Ghanaians, to take it much more seriously than we have been doing lately.
Right.
So I think questions need to be asked. I mean, some of us who are scientists have been on shows the last 2 or 3 weeks warning that something needed to be done. It didn't feel like much was happening. And now, unfortunately, we are being proven right yet again. And so at least now that there's evidence that Delta is here, and there's evidence that the presence of Delta at least appears to be resulting in a steep increase again in a number of cases. If you listen to reports, ICU beds are full already. So the situation is bad. And unfortunately, it's what we predicted would happen. And so now the question is, okay, now that it's bad, what do we do? And I don't, I think that is a question for some of people who determine our health policy.
Right. Now, WACBIB does a lot of studies and analysis of the virus and how it moves and so forth. You share a lot of information with the public about what you discover when you do these studies. I wonder whether anyone is keeping an eye on those who are getting hospitalized. Are there any vaccinated people among them?
I don't know. I mean, I think that would be data that I believe the Ghana Health Service would probably be best placed to provide, because they would have a record of those who are vaccinated. We are yet, our studies tend to focus a lot on trying to understand the nature of the virus. So we do a lot of sequencing. We've also done a lot of seroprevalence. So going out into communities and just sampling people who appear healthy to see whether they have antibodies that show that they've been exposed. So that is a kind of work we do. In terms of whether people who are hospitalized, Dr. Youngson may have some information since he's with the Ghana Medical Association, but that is more of a clinical issue. And that is typically going to be the purview of the Ghana Health Service. I will say, though, that data that is available from other countries suggests that rates of hospitalization are very, very low in vaccinated people. And the rates of severe disease are very, very low. There is lots of, I think, very strong evidence from Europe, from the US, from Israel, places that all are dealing with the Delta variant. But they are finding that in people who are fully vaccinated, the outcome is much less severe than in people who have not been vaccinated. So we don't, Ghana, of course, only about 1% of our population is fully vaccinated. So we have a small sample. So much not be vaccinated. That's just because we haven't vaccinated a lot of people yet. But I think in terms of teasing apart the data to see who is in the hospital, it is a valid question. It is something that I think we should be looking into, but I believe that, and I hope that, for instance, the Ghana Health Service would look into it.
Now, of course, the ideal would be that we actually put in measures that prevent the spread of the virus, especially the new variants. Let's hear what Dr. Nsiah-Sarrey said last night about how we can bring the numbers down. Listen to this.
What is fueling it is that if we've all gone to sleep, there's fatigue. Everybody is fatigued in following the protocols. So if you all wake up and then follow the protocols, it will bring the numbers down. That's the most important thing. It doesn't matter what type of strain it is. So please, let us all follow the protocols. Everybody, if for nothing at all, you wear your mask and then use sanitizers. If you don't have to go to a place, if there's even a funeral or there's a mass gathering somewhere you don't go, you are not forced to go there. Just don't go there. If you all do that, we'll be having a very good, and then bring the figures down.
Yako?
Yes.
Yeah, I'm just wondering. I'm sure you heard that. I'm wondering what your reactions are to that strategy.
I mean, I agree with it. It's what many of us have been saying, that there is, the protocols are still remain. In the absence of mass, of lots of vaccine available, the protocols remain our only defense against the virus. And yes, we need to adhere. I guess the only thing I would add is that his words need to go not just to the general public, they have to go to everybody. All right, we've seen bad examples being set across the spectrum. And at some point, we need to ask ourselves whether maybe stronger measures, for instance, limiting large gatherings, needs to be brought back. He said, if you don't need to go to a funeral, don't go. Well, then do we need to be having funerals right now? Do we need to be having large events of any kind? So I think, giving people the advice is one thing. And yes, we are adults and we expect that people should be able to adhere to it. But why we need to ask ourselves whether we need to start putting some of these measures back in.
Right. Well, I mean, at this point, I suppose we come full circle back to the issue of vaccines. And Ghana is, well, we're still not sure where we stand globally. What's your understanding of the space and, what Ghana's prospects are of getting another batch of any of the vaccines that FDA has approved so far?
Well, I think Dr. Nsias already said it best. I mean, there's been some promise of vaccines being delivered from the US. We don't yet know when they will arrive. He said soon. Soon can be anywhere from a few weeks to a few months. We've heard that I think Cote d'Ivoire has bought Pfizer, and those have been delivered. So people in Cote d'Ivoire are receiving Pfizer shots. I have heard this firsthand from colleagues of mine who work there. A number of countries, I mean, every country, every country is sort of trying to secure vaccines the best way they can. COVAX has been slowed because of the situation in India, but hopefully COVAX says they hope to be able to get back on track within a few months. So it looks like it's a waiting game. I think we have to double our efforts. If a country like Cote d'Ivoire can purchase 1 million doses of Pfizer, I don't see why Ghana cannot do the same thing. So I think we need to, in addition to waiting for philanthropy from countries like the US, I really hope that we are, working as hard as we can to try to secure, even if it's 500,000 doses here, 200,000 doses there, whilst we wait for these philanthropic donations to come in. At least in our own small way, it'd be great if we can begin to purchase some of these. So I know that these negotiations and discussions are not without challenge. So I don't mean to diminish how difficult it is to, in the current climate of lack of supply. But I believe that, we have to redouble our efforts. We have no choice. We have to find ways to get vaccines.
Dr. Justice Youngson joins us now over the phone. He, of course, represents the Ghana Medical Association. He is, in fact, the General Secretary. Dr. Youngson, it's a pleasure. Good morning to you.
Hello, good morning. As always, it's my pleasure as well.
So, Doc, help us understand the reality of the situation in hospitals. We keep seeing on social media that the ICUs are full and so forth. Is this true? What's the reality in our hospitals?
Okay, let's start this way. For some, let's say 1 month to some 2 months ago, we all realized that the cases were coming down. It got to a point where some of the clinics were not even, picking up cases on regular, duty days compared to what I said was happening some 2 months ago. But now we have seen a situation where the cases are beginning to pop up at the various health facilities. We are also realizing that generally a lot more younger people are also coming down with the disease. And then we've also realized that those who come in very ill, unfortunately, pass very early as well, i.e., they don't stay longer with us and then they pass. Kolebu, for example, had not had any COVID-related death for some weeks. But the previous week, we had at least 4. So gradually, the disease burden in terms of the severity of the cases, as and when they pop up, we realize that these are very severe cases. If you look at what is happening, our general numbers are also going up, and there are pockets of hotspots all over the place, not just in Accra, Shanti regions, other regions as well. So clearly, this could be the beginnings of potentially another third wave. We all pray against it, but prayer alone wouldn't work. We need to be practical and follow the scientific approach that we use to bring our numbers now down when we had our first and second waves. So clearly, this is where we are. Our ability to handle severe critical cases in terms of ICU space and what have you, generally as a country, we don't have a lot of space for that category of persons. That is not to say we don't have any capacity at all. No, we have. But in terms of the available beds, available equipment, oxygen points, what have you, we don't have enough. And as it stands now, most of the critical care areas are also flooded with COVID-19 patients. So clearly, even if we take it that this is just the beginnings of something that we all don't want to see, even at this point, we are beginning to get overstretched in those areas as we have described. And then those who also, for some reason, end up staying home for longer before they come in, as to whether they are doing home care or they are consulting who and who, sometimes we don't know, they are almost always brought in very, very ill. So anybody who should test positive, anybody who should have symptoms of COVID-19, please don't hesitate to ensure that you get to the health facilities as early as possible. But we need to go on an enhanced risk communication. We need to enforce the protocols. We haven't even had the ability to vaccinate 5% of our population. In fact, those who have had a full dose, they are just about 1%. So clearly, when we talk about scientific principles like herd immunity and all that, we are nowhere near there at all. And as we have always said, the fact that you have received the vaccine does not necessarily mean you are 100% protected. In fact, as we speak, there are people who have had the 2 doses and have still come down with COVID in this country. There are people who took the jabs from outside of Ghana, the US, the UK. They've come into Ghana and they've also had COVID here. So clearly, we all still need to continue with our protocols. And this is something that, as far as we are concerned, is non-negotiable.
Doc,
the state has to ensure that we all go back and do the right things. Yes, we may have been tired of the protocols and what have you, but we can't afford to lose it, especially now that we have the Delta strain in our communities. We cannot afford to let our guard down any longer.
Doc, please help us with some clarification here. Are you saying that of those who have been hospitalized in this recent spate, that some of them actually have had both vaccines, both doses of the vaccine, and they are still being hospitalized with COVID?
No. What I said was that they have tested positive for COVID.
Right.
The only advantage here is that they have generally had the mild form of the disease.
Right.
And that is what we all expect to happen
Right.
based on the scientific principles.
Right.
But occasionally, as has happened elsewhere, some people who end up with a very worse form. So the principle here, or the message here, is that the vaccine alone is not 100% protective. If you've had your vaccine, you should still continue to ensure that you adhere strictly to the protocol, especially in the midst of the fact that we haven't been able to vaccinate a huge chunk of our population, let alone get to the point where we can say we have herd immunity.
Right. Understood.
Yeah, and Doc, I mean, you talked about young people, contracting COVID-19. These young persons, some of whom you say are dying, are they? Do they have underlying condition?
Well, truthfully, the younger population who are now picking up the infections compared to the first 2 waves are people in their teenagers and what have you. Hitherto, most of the people who had a very bad cases and what have you were 40s plus, 50s, elderly and stuff like that. In fact, when COVID started, a lot of people felt that even kids or younger people were immune, stuff like that. They might never get the disease and what have you. But now it is not the case. We all know what has happened in Achimota. There are other schools dotted across the country who at one point or the other school kids have come into contact with COVID and diagnosed them. Yes, earlier, most of them, the disease burden wasn't that much in terms of the severity. But now things are beginning to change.
Is there a need for us to, and in fact, I don't mind hearing from both of you on this, both the doctor and the scientist on this one. Is there a need for us to adjust our strategy? Because the vaccines in fact, across the world, children have not been tested for most of these vaccines. So our plan in Ghana doesn't include vaccinating children just yet. But if this new variant is affecting children in this manner, should we be rethinking our vaccination strategy? I'll start with Dr. Bediako on this one.
So there are trials currently ongoing in children. And I mean, if you look in the US, they've already begun to vaccinate. Before it was everybody above 18. Now they've come all the way down, I think, to 10 or, they're vaccinating teenagers now. So they are already vaccinating children in the classical sense. Very young children, not yet, but I think it's only a matter of time. So yes, our strategy will have to change. But the problem is we haven't, we've not even vaccinated the adults, even the people who are within the current strategy. We haven't had the sufficient vaccines to vaccinate them. So switching and saying suddenly we're going to vaccinate children, in my opinion, I mean, yes, that we may decide to do that, but with what? We have the problem is getting access to the vaccine. The problem so far is not our policy. The problem is having sufficient vaccines to go around. We are supposed to have done 20 million people by the end of this year. We are now in July, and we've done, in terms of total vaccinations, I think it's somewhere around close to 1 million. But it's a 2-dose vaccine, so only about 350, maybe 1,000 people have been fully vaccinated. So we are way short of our milestones. So I think the issue right now, yes, we may need to begin to think about younger people, but the more substantive issue is access to vaccines. Now, it's a global problem. Countries like ours, lower and middle income countries, are bearing the brunt currently because of the vaccine nationalism and the lack of vaccine equity that has happened. But we still have to take, our governments have to take the initiative and have to do whatever they can do to at least get a trickle of vaccine steadily into our country.
Right.
The protocols, but at the same time, as Dr. Jansen has said, I believe in Dr. Nsia Asare has said, while we focus on getting vaccines in, countries, everybody is dealing with Delta. The difference between us and the US is that in the states that they have high levels of vaccination, Delta is not really resulting in a high level of hospitalization. In the states where they have decided not to vaccinate as much, they are seeing high levels of hospitalization. So till we get vaccines in, we have to adhere to the protocols. We cannot feel, pandemic fatigue is a term everybody throws around. In my opinion, Ghanaians cannot afford to be fatigued because we haven't vaccinated enough. Countries in Europe where they have 50, 60, 70% vaccination coverage can afford to start talking about being fatigued. We, unfortunately, whether we are fatigued or not, we fatigue. Because just go to the hospitals right now and you see the...
Right. We're going to try and reestablish that connection. Okay, we have you back now. We had a bit of a break at the end of your submission there, but I think we got the general thrust of what you were saying. Dr. Jansen, I want to bring you in on this, same issue, because in the past, the idea has been that we prioritize those who were elderly, those who had pre-existing conditions, and then we came to those who were in the... Actually, we prioritized the healthcare professionals, then the elderly, those with pre-existing conditions, and so forth. But now that children are just as much as at risk, from that clinical point of view, what would your suggestion be? How do we rejig this to ensure that we're protecting the most vulnerable?
Well, let me say, my brother, hit the nail right on the head. The key thing is we need to get vaccines. We need to double our effort. But let me say this. The national strategy has never eliminated children per se. No. What we did with the initial strategy was that based on the available scientific evidence and the studies that had been conducted and those that were ongoing, we also mirrored what, the scientific community generally throughout the world were doing, i.e., phase your vaccination processes or exercises such that those who were most at risk at the time, And these were the elderly and what have you, those with underlying disease burden, frontline health workers and others. Get them as the most prioritized group, or the first phase, or the first group, or whatever terminology you use, and then you come all the way down. It was always the understanding in our current strategy that as we come down and as scientific, information and research continues, definitely we were going to get to a point where the bit about those below 18 was also going to come in, because we knew that WHO, everybody involved within the health structure was actually working or researching into the safety of these vaccines in children. All these vaccines, most of them were given emergency use authorization, virtually all of them.
Yeah.
The long and short of it is that we have not completed a lot of the huge numbers in terms of population studies, for which reason it was skewed more to the adults who at the initial times were more or less facing the brunt of COVID-19. So clearly, our strategy still holds, except to say that now that the kids are also getting involved, what it means is that our immediate need for vaccines has even shot up. And that as the world clearly, as Yao said, in the U.S., the teenagers and what have you have all started taking their jabs. Some places in Europe have also started. So clearly, we now have a bigger population. The initial target population of 20 million was based on this segmentation, which puts that 20 million estimate for those really above 18, what have you. But now, technically speaking, we are looking at the broader population of whatever, 33 million plus, as we all say. We know the census is ongoing, so probably we'll get the accurate figures sooner than later. So now we have a bigger picture where everybody can be involved at any time. As the research goes on, the vaccinating, segmentation, as we have done the world over, is heading towards the very fresh or newer ones in the pool, i.e., those below 5 and what have you. They are going to get there in no time. And per the principles of vaccination in kids, especially below 5, has always been with us. So it is not strange. It is just the safety in this case that the scientific community was working at. But clearly, we are getting there. So we need to double our efforts and make sure that we get the vaccines. But even as we try to do that, the message is there should be strict adherence to the protocol. The state should take the lead and ensure that we enforce it. Over the period, we've all gone to sleep. We've all been complicit, including the state itself. We all know what has happened. But this is the time we need to change it, because we have to break this current chain of transmission that has started. From what we all know, the Delta variant is one that is very, very aggressive in terms of its spread and in terms of the disease burden. And we cannot cope. That is the truth. We cannot cope. If we allow what happened in December to happen with this Delta variant, most likely our system will come to a halt.
Wow. Well, Dr. Yankson, Dr. Bediakun, we want to thank you very much for your time and for clarifying the issues for us. We appreciate it very much. Dr. Yabediakun is a research fellow at the West African Center for Cell Biology of Infectious Pathogens, University of Ghana. Dr. Justice Yankson is the General Secretary of the Ghana Medical Association. Raymond.
I'm confused as to exactly what is expected of the ordinary Ghanaian. One, yes, I get it that I have to put on the mask again. I'm still having the mask on. I have to do the things that are expected of me, wash my hand. But I see virtually every other person I meet on the street, one, two, not following these rules. It's as if we have generally agreed at home that we don't want to follow the rules again. And that has been supported boldly by some government officials through their actions. That's without doubt. But what my fear is that two things. The government official is probably getting both vaccines done, sorted. Secondly, the government official is in the position to get better healthcare or even be flown abroad for some of these services that you might not ordinarily get. So that's what distinguishes you, the ordinary person, from the government official, who you saw at the funerals, who you saw at all of those gatherings, and you were so angry they did that and took a cue from and decided to not follow the regulations. I'm confused because we, on one hand, are pretending we are where the UK and other countries are when it comes to the vaccination. So because of that, because we are pretending to be there, we are pretending to also do the things that they are doing. So when you see the pictures on social media, they'll tell that, oh, you watch the stadium, right? Nobody was wearing masks. So I people still insist that we should wear the masks. But you are nowhere near where they are. And you're just that 1% of the population. That means that when I walk out, the tendency that I'll meet another person who is vaccinated is very low. So it should just click in your mind that you may be in a lot of trouble. And one thing that also caught my attention is when Dr. Jansen mentioned that clearly there are more people dying easily now because he says the time they spend with us in the hospitals
It's shorter.
is shorter. That means that the time that we're all afraid, people were dying, but not at the rate or at the speed that they are dying now. You might have gotten over it or being fatigued, whatever way. But listen, putting on the mask is way better than dying or having severe COVID. And that's what we should all be getting to. Because I am not convinced this vaccine that we are never going to know the timelines. Every time it's 25, 28, 2014, 15. We keep changing timelines when we are getting vaccines every single time. And even now, there are no definite timelines anyway. So you are not in any way protected. The only way you get protection is to take your own destiny into your own hands and say that, as for me and my family, we are going to make sure that until COVID is over, we continue following the protocols. And this is the plea I can put out there. Because you are going to suffer more than the people you think should be protecting you and are not protecting you. Because now it's between you and your God, actually.
Amen. Wow. Okay. Well, you've heard it, so you know what to do. And in the midst of all this, they say times are hard. That's what they say. How true is this? Let's interrogate it. When we come back, we'll look at increasing prices of certain key things like building materials, like LPG. I went to top up over the weekend. I was shocked. We'll be joined by Dr. Ibu Turkson, Senior Lecturer and Program Coordinator at for Economic Policy Management Program at the Department of Economics, the University of Ghana. Professor Eric Osei-Sibe is Associate Professor of Economics and Dean of International Programs at the same University of Ghana. Good morning to you both, gentlemen.
Good morning.
Wonderful. It's good to hear from you both, and we'll be getting into the issues in full after these.
Imagine say water wake up at dawn. You know both. You know chop. Where it vanish for your area for 2 weeks. You not get one drop safe inside your tank.
Hey.
Haja, our life was in dangerous. Only our neighbor get water with water tank.
Water tank?
Yes, water tank. Mamma mia, that water tank get meter for checking water level. That water tank be fine past Kumasi Selendion. That water tank be tough like Ghana Army. That water tank, they carry water pepe, so say some no go left inside the supply tank. What a tank! As my boss, Mr. Poncho, go talk.
Beautiful, durable, with water level indicator and accurate volume of water. Water tank. What a tank! By Duraplast.
We believe in the promise of your talent. We believe in your zeal to succeed. We believe in the power of your imagination. We see your imaginations coming to life. Work your way up. Leave the push to us. We've got you covered because we've seen humanity through it